Good afternoon, everyone. This meeting is now being broadcast live online. Hello, Javier. Would you like to do a microphone check for me?
Yes, this is Javier. Thank you.
Thank you. Sounds good.
Damon Silver, I see you. Can I hear you? Do a quick mic check.
I certainly can. This is Damon.
Thank you very much.
Thanks, Colin.
Bernadette, I see you've joined. Can I do a quick mic check?
Hi there. Yes, I'm here.
Thank you very much.
Sure.
Colin, I'm not seeing if Supervisor Wasserman has joined yet.
Supervisor Wasserman has not joined yet.
Okay. It is 1:57. I predict once again that he will tune in at 2 o'clock, and we will begin.
Just an announcement that the meeting is currently being broadcast live online.
Hello, Madam Chair.
There's the man. 1:59. I will call us to order in under 60 seconds.
And I assume Derek is watching, so this is my sympathy.
I don't even know enough to know if that's facetious or genuine.
Oh no, we are both Cincinnati Reds diehards, and they went down in defeat yesterday and today in the most embarrassing possible historical fashion.
I'm sorry to hear that, and I hope that I will now cheer you up by calling to order this meeting, a regular meeting of the Public Safety and Justice Committee on October 1st at 2 p.m. I will turn to the clerk to ask for a roll call, please.
Vice Chairperson Wasserman,
Here.
Chairperson Ellenberg.
I'm here.
Thank you. You have a quorum.
Thank you so much. And now we'll turn to public comment right now. Do we have speakers on public comment?
I have one request to speak.
Great. Let's set the clock for 3 minutes, please.
Our first speaker is Scott Largent. I'm unmuting you. Please accept the unmute. You will have 3 minutes to speak. 1 moment and we will have a timer for you.
Okay, ready when you are.
Go ahead.
Okay, good afternoon, everyone. Scott Larkin. What I am doing today, I took work off. I'm down here at the county building, breathing in some filtered air. I've been staying in the ghetto van, and I had asthma growing up, so this is just, it's been hard lately. And then I do work outside, so I try to wear my respirator all day long. But that's none of your concern. I cack up a lot of stuff, let's say, these days. What I'm doing a little research on today is we're preparing to file a Murgetta, if I pronounce it properly, motion in court. And this will hopefully start to shed light on what happened with the district attorney's office, the harassment from the San Jose Police Department, and then what really opened the door in the beginning of all this was the harassment from the Sheriff's Department. I don't forget, okay? I was able to communicate with my mom. It's been about 6 months now. she informed me that several investigators were sent to her home. And this is right after I started making public comment here at the Santa Clara County Board of Supervisors. Mike Wasserman, that's your district there. And of course, you were the mayor of Los Gatos. So because I came in here to put my grievances out on the table, ask for help, shed light on what happened to me in Los Gatos and what happened with the system, this was the retaliation. Now, why is that appropriate to send an investigator to somebody's mother's home like that? No probation, no parole. What I had a DUI 20-something years ago. It's unacceptable and it's not okay. The more I start digging into this, I just wonder why none of you pay attention. And this is directed at you, Jeff Rosen. I needed therapy. And 1 month into me not being able to see my child, that light should have gone off. And that's the point where you should have provided me therapy through victim services, not through public comment. I've spent 5 years putting my dirty laundry out on the table, so to say, when I needed to sit down and discuss how badly I hurt inside because I can't see my kid. How things are just extremely difficult and nobody wants to address my mental health issues, my sobriety. This is why we have so many people on our streets. This is why. So I'm frustrated. I miss my little girl. I miss her a lot. I truly do. And 6 months now. All right, thank you.
Our next speaker is Joel Silver. I'm unmuting you. Please accept the unmute. You will have 3 minutes to speak. The timer will start when you begin speaking.
Thank you. My name is Joel Silver, and I am a nurse at the behavioral health unit in the main jail. And I want to talk to you about some conditions and some issues facing us that we've been trying to fight them for years and haven't seemed to get anywhere. It mostly concerns staffing. We're chronically short-staffed. We're very tired. And recently with the reorganization by our manager, she has pulled 2 of our nurses out of our unit and made, though they're doing basically the same duties, they're working out of a different part of the jail, which has reduced our support on the mental health unit. And we want them back. We believe that they're very important. We need them for staffing. We need their presence if there's an emergency, if they help cover breaks, and they've been removed. She's also initiated a program with 3 assistant nurse managers, 1 for each shift. The problem is it has now taken 3 more nurses away from the floor into administration and increased the stress on the staff that's there, and increased the amount of overtime. Our proposal has been that we get rid of the assistant nurse managers, put them back on the floor because they do not help us with patient care at all on the floor, compromising both care and morale. Put them back on the floor, give us a nurse manager as we had before. That would give us 3 more nurses on the floor. It would decrease the amount of overtime helping the budget, and actually helping the budget further if the A&Ms who claim the bulk of the overtime shifts for themselves are by far the most expensive employees with a base rate of $10 an hour higher than the rest of us. So if you figure they're averaging each 24 hours a week of overtime, think about how much money that is. If you put them back on the floor, there's fewer overtime shifts and a far less expense. And we have the support and help we need. And we really want our 2 outpatient nurses returned back to the 8th floor. We really need their support. We need their assistance with coverage, especially when it gets busy and the acuity is high. If we've got 15 people on suicide watch and 15-minute checks, we really need their help, and we don't have it. and the most are afraid to go to our manager, as her management style, Marianne, tends to be very Machiavellian. So there's a fear-based culture, which doesn't hurt, help.
Thank you.
Our next, I do have two more requests.
Okay, and let me just say to folks that we determine the amount of time of public comment based on the number of speakers. With 4 speakers, we are still good in the 3-minute range, but I'd like to ask right now if anyone else desires to speak on public comment to please raise your blue hand now. When the next speaker begins speaking, I'm going to close public comment. Thank you. Go ahead.
Our next speaker is Todd Tedesco. Pardon me. I'm unmuting you. Please accept the unmute. You'll have 3 minutes to speak. The timer will start when you begin speaking.
Thank you. My name is Todd Tedesco. I'm a nurse on 8A. I've been a nurse for 22 years. I worked 5 years in critical care, 17 years in psychiatric medicine. I have a bachelor's and I'm board certified in mental health psychiatric nursing. I have a prepared statement that I'll read that is available upon request. The outpatient units B and C have continually moved as the jail is under construction and are named according to the floors they're on. I'll simply refer to them to B and C. There's a third unit, which is a COVID-19 unit for people who with a mentally ill history. Inmates in that quarantine for 2 weeks until they're medically cleared from COVID. The 2 units, B and C, have been combined and are now staffed by 1 nurse and moved to the 2nd floor and now under the control of medical. The COVID-19 quarantine unit for people with a medical history is now combined with another outpatient unit with increasing workload dramatically for both staff positions. The 2 main problems with these changes include the staffing positions decreased from 3 to 2 on the floors that were covered are now increased from 3 floors to 4 floors. This diminishes the ability of the nurse to encourage the mentally ill patient to take the medicines, resulting in more admissions to 8A for crisis stabilization, increasing in overall decompensation, including an increase in suicide attempts. The outpatient nurses are physically stationed were on 8A before the change took place, and they responded to many crises within seconds. The move to 2nd floor has increased their time, making them unavailable for immediate emergent nursing care. Currently, there are 3 assistant nurse managers. The role of the nurse manager is purely administrative, and this is supported by upper management, including Mr. James and manager Ms. Anderson. The 2nd shift nurse manager, he has stated that his job is purely administrative. I've asked him twice for help, and both times he has become hostile and aggressive, threatening me to write me up as I ask for help. I'm currently moving more to the medical to avoid this confrontation. One possibility for change would be having the assistant nurse managers removed, rotating charge among quality staff, and 1 supervisor for day shift, which is the medical model currently. The problem we have is that the officers seem to be able to think that they're dictating medical care and have stopped medical care for their own benefit. I'm running out of time.
Our next speaker is Robert Aguirre. I'm unmuting you. Please accept the unmute. You will have 3 minutes to speak. The timer will start when you begin speaking.
Yeah, Robert Aguirre. Yeah, I want to talk about several of the problems that we see going on around the entire county, actually. We have a lot of people that are unhoused, that are living outdoors, that are being subjected to a lot of things that are affecting their mental health. And I think that the fact that we don't have a central place for people to be able to go, or places for people to go, we don't have enough recovery beds for people. We don't have enough places where people can go that want to get off whatever is affecting their health. We don't have enough places for people to go to be able to even stay for a night if they want to. there's a lot of people that don't have showers that are available and regular hand washing stations and things like that throughout the entire county. Yes, I know the city of San Jose is doing some things about some of the encampments, putting in, like I said, hand washing stations, porta potties, trash dumpsters, and that sort of thing. But it's not broad enough. It's not affecting enough people. And the people that do have the advantage of that, it's great. It's wonderful for them. But we still don't have the mental health that goes out to help these people. I have one case in particular that I've been working with. This one woman. She's been in the city of Campbell, being harassed by the police there, being put in a position where she is being forced to go into court over and over again over trespassing charges that are brought against her, and she's been forced into Judge Manley's court. This woman may indeed have some problems, but the way that you deal with these problems is not by forcing people into a court situation that is continually shifting. I've been to her court hearings several times, and they have been continued without any notification. Not even the public defender that's representing her is able to do that. And I and another advocate are trying to get on as her advocate to be able to go and speak to the judge on her behalf, because when you put somebody that has mental stress in front of a judge, and that judge just has a very little amount of time, doesn't want to listen to the stories that these people are trying to tell, then they just get shoved aside. They don't really feel like they were ever listened to, and it just exacerbates their condition and makes it much more difficult for them to be able to recover from whatever trauma they may have experienced. And the fact that the city of Campbell doesn't have any place for people to go, and continues just to push people out of Campbell to try to push them into San Jose and make it their problem, and then so that way Campbell doesn't have to deal with it, to me is really criminal. And I think it's something that we need to look into and figure out how we can solve this problem much better.
Our final speaker is Angela King. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. Pardon, 3 minutes to speak. The timer will start when you begin speaking.
Okay, hi. Thank you, supervisors, for hearing us. I know you guys have been very responsive and helpful to us in the past, and I appreciate it. And I racked my brain because I was talking to RNPA, and they were saying that and I know there is a lot of shortage in staff in custody. If you look at Transparent America, it is astronomical the amount of overtime we are paying. And I wanted to try and bring something to the table that would be helpful for us, but also within your budget crisis. And I was wondering if you guys could take a look at or do a cost analysis for 12-hour shifts. I believe that we could then use the quantity of nurses we have. I haven't done an analysis, but that was an idea that I had, that might help with the staffing and help you with the budget, kind of a win-win. And so if you would consider that, I would greatly appreciate it. And then secondly, I wanted to just reiterate the problems that we're having on the 8th floor psych unit. I'm representing several nurses who have talked to me about this. They have gone through years of poor management and remote managing, remote supervising. And honestly, what they all are requesting, and I believe would be good, is to have one supervisor up on the 8th floor during the day, all day, delete the A&M positions, and that person would have their finger on the pulse. When you're remote supervising, remote managing, you're not seeing their day-to-day struggles, and it's just not working out. And it hasn't for years. They've gone from one bad situation to another bad situation. So if you could consider that, I think they would be so very grateful. I know I'm representing about 5 or 6 nurses who have come to talk to me. And then I just want to reiterate about the possibility of 12-hour shifts, and if that would work for both nurses and the county's budget. Thank you so very much.
That concludes our speakers.
Thank you very much. I appreciate all of the folks that take time to share their thoughts and suggestions during public comment. We're going to turn now to the consent calendar. And Supervisor Wasserman, do you have any changes, additions, deletions from the consent calendar?
I have a motion to approve items 10 through 14. Once you've heard from whomever wishes to speak.
All right, before I second that motion, I want to make comments on 2 items on consent. I don't want to pull them, but just make a couple of notes. First, on item 11, the semi-annual report on the 3-year adult reentry strategic implementation plan, I'd like to request that the recommendations provided in the report for maintaining the reduced jail population ongoing be brought back to a future PSJC meeting for consideration and discussion. One of the silver linings of COVID is that we were able to surpass our goals of reducing jail population through coordinated community diversions. And I'd like us to use this opportunity to consider what has been working and what we might continue to keep in place beyond the health crisis. And second, regarding item 13, the reentry annual report is excellent. I do want to keep it on consent, but I want to call out pages 12 and 13 in the report, which provide the program completion rates for substance use treatment services and behavioral health programs. I think this data is timely, and I'd like us to review and consider it during our study session today. And with both of those comments, I'm happy to second, but before we vote, I will look to the clerk and see if we have any public comment on the consent calendar.
I have one request at this time.
Okay, one request will do 2 minutes. Thank you.
Our first speaker is Scott Largent. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you, everybody. Scott Largent. You know, as far as item number 12 on the consent calendar, the Domestic Violence Council, the annual work plan and budget, the gals that run that gig for the county, you know, I've been going there for, I think 3 or 4 years attending these meetings. Prior to COVID, they were really getting that committee back together. They were making quorum, but they constantly, I mean, of course, everybody needs more money. I get that. But there's a lot of basic needs that I'm sure a lot of you can figure out, you know, pull some strings, ask for some donations. It's very frustrating, some of the stuff that they're talking about in there, and that it just can't be solved very fast. I mean, I think I could stand out on the corner with a megaphone and a sign and get people to donate, you know, a pepper spray, a coat, you know, a laptop, a cell phone, something for a woman that's, you know, been booted out of her place, can't go back, needs help. You know, they're just simple things. So I'll leave it at that. Maybe somebody can kind of hear that. Oh, and one other quick thing. Those meetings would be great if they were broadcasted live. I know we're now doing the Zoom thing for that committee. We've started to slowly staff it properly. It needs to be like every other committee. And then the public can participate. They can go online. They can watch older meetings like all the other committees. Okay, thank you.
That concludes our speakers.
Thank you so much. We have a motion to approve the consent calendar, incorporating my comments, and a second, and let's have a roll call.
And Madam Chair, I do agree with your seconds regarding items 11 and 13.
Thank you very much. I appreciate that.
Vice Chairperson Wasserman?
Aye.
Chairperson Ellenberg?
Yes. Thank you very much. We'll move on to item 4, which is to receive verbal reports from the departments on response to COVID-19. And I think I'll take public comment at the top of each item today. Sometimes we do it at the end, but I want to try this. So if we have any comments on item number 4, which are the verbal reports from departments in response to COVID, let's have those right now.
I see no requests at this time.
Okay,
My apologies. Scott Largent has raised his hand.
very good. 2 minutes, please.
Our first speaker is Scott Largent. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Okay. Good afternoon, everybody. I do appreciate the opportunity to speak. I was hunkering down here, getting ready to listen to the different departments, but public comment at the beginning is not a problem for me. I have been attending and this is on topic for what we're talking about with the COVID issue. I've been attending the homeless task force that was set up through our county right now. I come to these meetings just to let you guys know the experiences that I'm having dealing with COVID, living around your building here, just what it is for somebody to be in my situation. I normally work every day. I keep trying to put things in front of you guys because I'm on the trenches. I'm literally right out here dealing with this stuff. You guys get in your cars, you have your little key pass, you're in and out. You don't really walk the streets. You, of course, don't even dare go left when you go out of that jail there. The stuff that I keep talking about is just not there. Please go on a field trip. Please just walk outside, ask security to go with you, ask a deputy in plain clothes to go with you. Start really experiencing what it's like on the streets, because I do not think people are paying attention. I'm very concerned about that homeless task force. I'm worried it's a dog and pony show. That was in Cortez's lap, and then it got pawned off onto Cindy Chavez. I think she's bullying everybody during that committee. I just worry. I constantly worry that these people are suffering. And take a gander right out in front of your building here today. Every single bench has somebody sitting on it suffering, and nobody's out there talking to them. Nobody's bringing them water. Nobody's bringing them a mask. Nobody is doing anything at all. Do something. Thank you.
That concludes our speakers.
Thank you very much. The verbal reports now, I'll turn to Martha Wapinski to kick those off, please.
Thank you, Supervisor. So the Superior Court indicates they have nothing new to report since last month's PSJC meeting. So with that, I'll move on to the Office of the District Attorney. D.A. Rosen, please.
Yes, good afternoon, everyone. I have some brief updates about things in the DA's office since COVID. Currently, the criminal courts have about 2/3 of their normal criminal departments open as to what they had before COVID, but only about 1/3 of the jury trial departments. And we understand the criminal courts won't be adding additional jury trial departments through the end of the year. So at any given time, we have at most 30% of the trials we used to try going out each week, and often less. After an initial dip in crime, when COVID began, we had a significant dip for the first month when everyone was really locked into sheltering in place. Since then, crime has returned to 2019 levels, which is, of course, higher than it was during the initial shelter in place, but overall, from a historical perspective, still a fairly low crime. Until recently, most of the criminal cases were being postponed due to COVID, and that's created a backlog, particularly of out-of-custody cases. Meanwhile, in the DA's office, we are implementing reforms that are changing our focus toward violent crimes, burglaries, white-collar crimes, and away from being the middleman in a drug addict's treatment or being the debt collector for DMV. So we're refocusing our resources. The burdens of all of the delays in court in terms of the trials are being acutely felt by our crime victims, who are having to wait longer for their cases to conclude. And the caseloads of our deputy DAs are steadily increasing. And when the court is able to open back up more fully, these increased caseloads will add increased stress to already pretty busy assignments. But I do want to point out that our court in Santa Clara County is, given its size, is trying as many or more criminal cases than any other superior court in California. There are many courts that have tried maybe one case or haven't tried any case at this point. So we in the district attorney's office are very appreciative for the court's efforts to try as many cases as we have been trying. Thank you.
Thank you. With that, we'll move on to the Office of the Sheriff, please.
Hi, good afternoon, everyone. Under Sheriff Rick Sell on behalf of Sheriff Lori Smith. I have in the room here, to my right, Assistant Sheriff Doty, to my left, Assistant Sheriff Tim Davis, who's in charge of Custody Bureau, obviously. And we also have Sergeant Renee Menchaca, who's in charge of our COVID-19 unit at this moment, who will provide an update to the committee on our response to COVID-19. With that, Sergeant Menchaca, you have the floor.
Thank you, sir. Good afternoon. I am Sergeant Renee Menchaca, and I'm currently assigned to personnel. I am part of the team who oversees all matters directly related to prevention, detection, and the treatment of COVID-19. So far, our agency's efforts to mitigate the spread of COVID-19 in our inmate and employee population have been successful. We have managed to stay ahead of the virus and have kept our overall infection rates at a manageable level. As you know, much of this can be attributed to our contact tracing efforts and continued partnership with Custody Health and County Public Health to conduct asymptomatic surveillance testing on the aforementioned populations. Our agency is also preparing for the upcoming flu season. The similarities these viruses share at onset of illness may create difficulties distinguishing them from one another. The Sheriff's Office continues to share all of its statistical information via our agency's COVID-19 dashboard, which is available to the public and our employees. The dashboard was recently updated to help present the statistical information in a more friendly, user-friendly fashion. And as you can see, the dashboard is up. We are on the portion of the dashboard with the COVID-19 data about our employees. So to date, we have tested 2,358. We have 51 positive cases, have had 51 positive cases. And currently there are 11 active cases. If you can go ahead and screen down. It takes us to our COVID-19 data about our inmates. Currently, we have 2 active cases in custody, and in custody today, we have 2,057. If you can go to the next tab of tests. Thank you. So to date, we have tested 8,233, and we've had 177 cumulative positive results. As you can see, all the way to the right, we have had less than 1% test positivity rate, which is great. We are very proud of the efforts of Custody Health and contributing to the employee screening and inmate screening. And also we're very proud of our IS department and staff who have contributed to this dashboard. Moving forward, our agency will continue to be proactive in its approach to this pandemic. We are confident in the infrastructure we have created to mitigate exposures, and we are confident in our ability to navigate the next phase of this pandemic.
Madam Chair, may I ask a question of the speaker? You're muted.
Yes, absolutely.
Thank you. Sorry for the interruption. I'm just trying to understand, you've got 177 positives out of 8233 completed. That to me is 2.2%. How do you calculate the 0.39? That's different than what we do like on the public health departments. How is that percentage arrived at?
So the 177 is cumulative for inmates that are actually tested outside of our correctional facility. That includes VMC and other locations that Custody Health has provided to our staff to put into the dashboard.
Okay, but 177 divided by 8233 is 2.1%, which is great. I'm just asking how you get to the 0.39. What two numbers do you use to get to that?
It's a 14-day average, so you're not using the number that's up there. It's it's an average of 14 running 14 days.
So that's the last 14 days positive results out of testing?
Yes.
Wonderful. So you're at a third of 1% positivity rate over the last 14 days of testing.
Yes.
That's fabulous. And how often do you test each of the inmates?
So we have a recurring, more recently we started testing. I think they're coming back every 4 to 6 weeks. I'd have to lean more towards where Custody Health is on that. It took us a while to get to that point, however, as it took us a while to test all new bookings. And my apologies, this is Assistant Sheriff Davis speaking, sorry.
Yep.
So we are continuing to expand both the testing frequency and the retesting structures for both inmates and staff.
Wonderful. Thank you very much, Madam Chair. Thank you. We now all testing can be done with those short swabs, and people can test once a week if they want to. So I certainly hope all of our correctional people and inmates can test as often as you can make it happen, because then we can find out about things sooner and quarantine and take actions. Your percentages are excellent. And I hope you work with the public health department to get tested more frequently, since it's not that Q-tip anymore that goes up to your brain. Thank you.
And I want to just echo strong support for those sentiments, Supervisor Wasserman. Thank you.
Yep.
Are there any questions?
Oh, sorry.
That's okay. That concludes my report. Thank you.
Excellent job.
Thank you.
Very much. With that, we'll go ahead. I'm going to ask you to share your screen, and we'll move to the Public Defender's Office. And if someone's speaking, they're on mute.
I'm sorry, Martha, who did you call for?
A public defender, please.
Oh, Martha, thank you. This is Damon Silver, Assistant Public Defender on behalf of Molly O'Neill. So I'm going to
One moment, sir. I'm so sorry, Damon. I was having a tech glitch too, and did have a question on the previous item as well. If you could just give me a quick second to find this. You know what? I'm having a whole technology thing going on here. So why don't you go ahead, Damon, so I don't delay everybody, but I'm going to come back to Custody Health with some questions.
Feel free to interrupt me whenever, Supervisor. In terms of a COVID report today, I think at the outset, we would echo many of the comments by DA Rosen in terms of our anticipation of the courts in essence, fully reopening and dealing with the backlog that was created months ago. As we understand it, though, at this point, the court has completed its scheduled phased reopening for the remainder of this year. PDO continues to strategize staffing solutions for the courtroom, which now require more than our traditional staffing levels, in part because of the addition of video appearances that in essence happen simultaneously with the live appearances that take place, as well as just managing the in-court workflow in the safest manner possible. Also, PDO is begun using our entire executive management team and our supervisor team to staff an intercept and triage table outside of the Hall of Justice. The goal is to reduce the number of clients that are in the building at every given time. So we're all taking turns to go over there, and in fact, I'm personally managing or helping appear on a violation of probation calendar these days. We continue to have two primary concerns at the Public Defender's Office regarding ensuring the safety of everyone at the court, including our clients and our employees. Those relate to in essence, the occupancy level at HOJ, as well as identifying the agency that's best situated to assume the responsibility for enforcing the public safety rules. In other words, who talks to people when the rules are being broken. We continue to discuss, though, these issues with the court and the sheriff's office in hopes of, in essence, identifying the best solutions and how we can potentially share that chore among all of us. Finally, our post-conviction and outreach team continues its weekly direct outreach to the high concentration homeless locations in order to provide not only hygiene kits and hygiene instructions, but really to address issues related to missed court dates as a result of the shelter in place. We want to get people back to court without having to be taken in by law enforcement. And we're also networking with homeless and housing insecure youth who are facing the digital divide in attending their virtual schools. In particular, we've been focusing those efforts in South County. So I'm happy to answer any questions, but that's the update from the public defender's perspective.
Damon, thank you so much. I have now rebooted. And before we go on, I want to come back to the sheriff's report with just a couple of comments, please. First of all, thank you for updating the COVID tracker by restoring the inmate trend data from the start of the pandemic. However, in the spirit of not allowing any good deed to go unpunished, I'd like the department to work towards applying those same updates to the staff dashboard by providing testing and case count data. Will this work from the sheriff's end, Rick?
Should.
Great. Thank you so much. I appreciate that. All right, Martha, who's up next?
So moving on to the Independent Defense Council, Sylvia Rose McDonald. And you're on mute still, Sylvia. There you go.
Yes, I am. Sorry. Thank you very much, everyone. I really don't have any update. I think all of our operations continue to work as they have previously, and we're collaborating with everybody as much as we can. So I'm happy to answer any questions.
Thank you, Marielle. I so appreciate that. And you are a great model of showing that we do not have to give updates when there is not actual new information. Thank you so much for all of the work that probation is doing.
Moving on to probation, Chief Garnett.
Martha, your sound is kind of funky.
Let me work on that. Chief Garnett.
Hi, good afternoon, everyone. So I'll be very, very brief. I'm going to start with the institution since that's what folks seem to be the most interested in. Big news is starting October 12th, we'll have in-person instruction for school. So that is wonderful, wonderful news.
That is great news.
We continue to be at an all-time low at both facilities. Our intakes have gone down a little bit. They were up the last time I reported out. The community-based services are still being provided via Zoom. Great news, many of our disaster service workers that were assigned to juvenile hall are being able to come back and just be on call for the contact tracing. So that's really good. And then I know it's a little bit unusual, but I'm just going to take 1 minute to just do a really big shout out to the staff at Juvenile Hall and the Ranch. Since the middle of March, these staff have literally been coming to work while most everyone else could work from home and shelter in place. Additionally, the days in custody are usually packed full of activities, school, community-based groups, dogs, visits from family, etc. All of that stopped in the middle of March, and our staff have had to pick it all up. They quickly pivoted and have done everything for the youth in custody, including evacuations of the ranch and housing out of county youth during the fires. So a big shout out to all of the staff in the institutions, the counselors, cooks, maintenance workers, admin support, schedulers, etc. They've shown up in a manner that should make us all very, very proud. And I just want to, in 1 minute, just name the leaders of those institutions right now. Sean Rudy, Carl Tatamaro, Joe Ugaldi, Mark Utzi, Rosa Velasco, and Kevin Cooper. And then, of course, Deputy Chief Nick Burchard's been at the helm of all of these efforts. So just a big shout out to them. And then I'll hit these super quick. Adult services, CDCR is still not taking new admits from They're only taking new admits from 4 counties. We're not one of them. They're piloting those 4, then they'll move on. They've released all the early releases that they're going to release to us, it appears. We have more probation staff going to court this month than we have been. And I think the district attorney and public defender mentioned that. We're working closely with the courts and our partners to make sure that our staff are as safe as possible as this expands. We've installed plexiglass in the screening station at adult probation on North First, where the sheriff's deputies do the client screening. In juvenile, pretty much everything has stayed the same. Youth and out-of-home placement are being seen to standard, which is monthly in person as mandated by the state. We're seeing in-person youth that are the highest risk, highest need. The rest we're still seeing remotely. And that's it. No other updates. I'm happy to answer any questions.
Thank you so much, Chief. Sylvia, I called you Marielle for no apparent reason. It's almost as if I've been stuck in my house for 6 months.
I totally forgive you, not a problem.
My apologies for that.
It's actually a compliment.
Goodness. Supervisor Wasserman, do you have any questions?
No questions.
Okay, Chief Garnett, I do have just a couple of questions. In the information provided to the board off agenda, the department listed that you're working on constructing a gazebo to facilitate outdoor family visits for juveniles. And I'm aware that in adult custody, minimum security inmates are currently allowed to have family visits in outdoor courtyards. What is it, just the construction of the gazebo that's keeping us from allowing family visits outside now?
I'm gonna punt to Nick, but before I punt to him, I do want to say, with the exception of maybe 2 other juvenile institutions, no one else is allowing in-person visiting with family yet. We are absolutely moving there, and he can update you.
Good afternoon, Supervisor Ellenberg and Supervisor Wasserman. Yes, the James Ranch is creating that gazebo that you spoke about. We're almost done. So we're hoping to have visits in a different fashion than what we used to do visits sometime in the middle of October for both Juvenile Hall and the James Ranch.
And so, Nick, thanks. How are we planning ahead to facilitate indoor visits? Obviously, the fire smoke is currently making outdoor activities hazardous, and the weather will get much colder soon. What are we thinking about?
So right now we're just planning for outdoor because we have covering both the Juvenile Hall and at the James Ranch, so that we can facilitate those outdoors with covering in case the weather becomes rainy or cold or it's too hot. Indoors is going to be a very different kind of setting, and we'll have to figure that out along with public health and taking their guidance, because that's what we've done for the outdoor.
But the plan is continue outside and just make it a little bit more weatherproof?
Yes, and I think that we're going to be able to accommodate that and make parents happy, kids happy, that they at least get to see their loved ones.
Great, thank you. And congratulations on getting the school started again. That really is fantastic news. Thank you so much.
You're welcome.
Madam Chair?
Yes, sir.
If I may just throw out there, there was a change made in the last 48 hours from public health regarding tents and enclosures. It applied to restaurants, but it applies to everyone. This may or may not be helpful to what we're trying to accomplish at the ranch as far as visitations. Up until yesterday, only one wall of the tent could be closed and the rest had to be open. Now they have revised that to only 2 sides, faces, need to be open and the rest can be closed. And they made that change to protect from the wind and rain as things get colder, and also to make the propane gas heaters more effective. So that may or may not be of help as they're setting up the gazebo, the tents, whatever visiting areas.
Great. Thanks for that information.
Yep.
Yeah, thank you. Great tip. Martha.
That will move to Reentry Services. Director Aguirre.
Good afternoon. Just 2 quick updates. Our first one is that we continue to increase our collaboration with the Sheriff's Office, Probation, Custody Health, Office of Women's Policy to coordinate the discharges of women. So there's about 160 women in custody, so it's a more manageable number of individuals that we could discharge, and we leverage our service navigators to assist those clients. So it has increased over time. And then second and lastly is just to remind folks, we have an amazing opportunity for folks to donate to our clients. We have a virtual Rise Up and Run. It's a virtual 5K. So people are interested, they could register and they'll get an amazing shirt and a medal. Registration you could go to the county's website and just put in reentry and it'll go to a link. And I want to applaud and thank Sylvia Perez McDonald, our director from IDO, who reached out to a lot of attorneys, both county and private attorneys, and they raised over $3,700 and brought in a lot of registered participants. So thank you so much.
That is awesome. So I have registered. Supervisor Wasserman, have you registered yet?
I don't believe I have. I got to look into that.
All right. I bet Javier can send you a link.
Absolutely.
This very afternoon.
Please do.
Thank you.
Outstanding. Thank you.
Date?
You could run your virtual anytime between October 24th and November 7th.
Oh, okay. So it's not like the
run on
it's
your
not like the turkey trot on Thanksgiving Day.
No, you have plenty of time.
Good.
Thank you.
Can we have a report back on who signed up?
Oh, absolutely. Yep, we'll definitely do that.
That's great. But let's please not necessarily report out on people's times.
No.
I thought that's where you were going, Sylvia.
Just the top ones. Thank you.
Yeah, the top would be great. Go ahead, Martha.
Our last presenter for this item is Pretrial Services, Director Fisk.
Okay, I think it's my turn. I'll just take a quick moment to cover 3 brief points. We're focused on continuing to adhere to the public health orders, which for us means rotational in-person work, largely working remotely, but we do come into the office to see the people that need to be seen in person. Not currently drug testing. We would like to resume that when possible. We are happy to report that we're stabilizing the client load. That's been with great help from the court, the Public Defender's Office, the ADO and IDO, who have been willing to reach out to clients individually and help them to resume or continue to be in compliance. Of course, the court has also resumed. They're hearing a lot of cases, and so a lot of cases have been resolved. And with some extra help, we're starting to get closer to our goal of being closer to about 75 clients per officer, and spreading out the electronic monitoring work, distributing that among more officers. And the third thing I'd like to report on is just a challenge and an opportunity. We're all familiar with justice delayed is justice denied. And so our focus right now is on getting reliable information and updated information to all of our partners sooner. The sooner we can get and the more reliable that information is, the better services we can provide. And really looking at everything that we do and what's been done partially on paper, partially in a computer and by other means, fax machines, and looking for, since a lot of us are working remotely, how can we share that information sooner and in better way? So one of the key areas is to provide better updated information to the court in the earliest stages, and to have information available so that parties can go out on demand and see it rather than the individual exchanges. That's my report for today.
Thank you very much.
Okay, I'm going to keep my video off and see if that helps my audio, but we're done with the report out.
Yes, it did.
Did we hear from Custody Health?
She is on the Zoom if you'd like a report from Dr. Day.
Well, Dr. Day, if a report wasn't requested by Martha Wapinski, and I certainly won't put you on the spot. I did think that we would have a report on a COVID update from Custody Health. So let me just start. That is hardly a way to welcome you, Dr. Day. But let me extend that welcome to Dr. Eureka Day, who's our new Custody Health Services Director, to the committee, and just make a couple of quick comments. I want to thank administration, Custody Health, probation, and the sheriff for providing responses to some of my questions in an off-agenda memo to the board, and I look forward to the next report, which I believe is expected to be delivered on October 15th, in particular for answers to my and Supervisor Simitian's questions regarding staff and inmate surveillance testing policies, in particular clarity on the authority of the public health officer to enforce testing protocols for staff. So just teeing that up, and look forward to seeing that report on October 15th. And with that, would you like to make a motion, Supervisor Wasserman?
For item number 6, receiver report, we don't need one. Or to your request, Item 4 was receive report. Yeah, that was the verbal report from the departments.
Yeah, that's what we just finished.
Yes.
Yes.
We don't need a motion. If you want a motion, I'll give you a motion. A motion to receive.
I don't need your motion.
Okay.
All right, then we'll move on to item 5, which is to receive report from the Office of the County Exec relating to reports requested by the board regarding jail reform efforts. And let's go first to public comment if there are any, please.
My apologies. I have no requests for public speakers.
Okay, great. Then I'll turn to Dr. Smith, or whoever is presenting on your behalf, on his behalf.
This is Martha again. I'll go ahead and present. And again, my apologies.
Martha, your sound.
Again, my apologies. Can you hear me better now?
A little bit.
So again, my apologies. Under item number 4, we'll make sure that Custody Health is added to the COVID verbal report. Under number 5, we have a short presentation, but it's very short and not very needed. What I do want to update is there are 2 more reports that have been turned in by the Sheriff's Office. So there are fewer outstanding report backs on the jail reforms referrals. Just want to let you know that with the various jail reforms referrals, we will be reporting back to the board and PSJC on a schedule in the near future.
Okay, let me check with Supervisor Wasserman. Do you want to hear the report or go straight to questions?
Straight to questions is fine.
All right, and do you have questions?
And let me go to my item number 5. No, it was really just kind of a comment. And what I would say, and I think this was an excellent report to come back with the number of referrals that have been put on to our staff and administration. I know when I saw that, I went to go look to see which were mine because it had been a while and didn't have any time certain. But I think what we have, Madam Chair, in this area and at the board in general, is if we're adding on more work and we're cutting our staff, we may need to do some prioritizing of referrals that are out there, because these are just the ones relating to what you and I are doing right now. And there's simply not enough time. And if they attack them in chronological order, that may be not be what's the preference is. I don't think we can put on more workload and cut staff unless we prioritize. It's just not right.
I'm a little panicky that you said cut staff twice in that comment. I have not heard that we are officially there, and certainly hope that we don't get there. But I certainly hear you loud and clear about being concerned in not further burdening our staff in focusing on the referrals that are already out and have been approved. In reviewing the referral list, I did notice that many of the outstanding items still had vague dates for which they could be expected at PSJC, which is what Supervisor Wasserman, I believe, was referencing. I think I might be a little bit antsier than he is. We have 2 committee meetings left in this year, and I'd like to request an off-agenda report with a schedule of which PSJC meetings we can expect to hear the presentations of these reports. And I recognize that we likely won't be able to entirely catch up on the backlog within the next 2 meetings, but I want to be sure that we are keeping the ball rolling. So whatever can be presented in the next 2 meetings, please share an off-agenda report with us so that we know what to expect. Thank you so much. So we're turning then to item 6, which is to receive a report from the Office of the County Executive, the Office of the Sheriff, and the Probation Department relating to civilianization for the Office of the Sheriff and reducing institutional costs for county adult and juvenile criminal justice facilities. And I'll ask first for any public comment.
Currently have 1 request.
Okay, let's do 2 minutes, please.
Our first speaker is Sparky Harlan. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. Timer will start when you begin speaking.
Hi, this is Sparky Harlan, CEO of Bill Wilson Center, and I'm here to speak in support of Harvey Rose cutting staff at Juvenile Hall. I've been advocating for decades on reducing the number of kids at Juvenile Hall and having them served in the community. And when we were doing disproportionate confinement of people of color, as we reduced the population, the goal was to cut staff and distribute that money to the community, and that never happened. And most of the staff was not cut. 42 open positions cut since 2012 is negligible. And the idea that DJJ, Department of Juvenile Justice, returning to this community will double the population in Juvenile Hall is just not accurate. Most of those young people are age 18 or over and are being treated either an adult, or even Bill Wilson Center is now taking some of those young people returning from DJJ. So I urge you, read the report, read the article that came out of the San Francisco Chronicle that shows Bay Area wide we are reducing populations in our juvenile halls, but we keep the same staff. There's always a rationale. And when I saw that 70 probation officers had been assigned to EOC, and it seemed to be with little, adverse effect to these institutions, I question whether we still need these high-level positions. I think we need to fund behavioral health and substance abuse treatment and more to the community, and not keep staffing at a high level our institutions like Juvenile Hall. Thank you.
That concludes our speakers.
Thank you very much. Martha, are you leading this one as well?
Yes, yes, Supervisor. Is my audio any better? I've been working on it.
It's all right.
So we're going to go ahead and cast the presentation. So this is, as you said, this is a joint report between Sheriff's Office and Probation. This is as a result of the Harvey Rose review of the recommended budget in 2 areas. For the Sheriff's Office, it was a civilianization plan where functions that don't require sworn staff might be replaced with civilian staff. And then for both Sheriff's Office and Probation, Harvey Rose recommended looking at the reduced populations in the institutions and said there may be ways of reducing staffing. So as you can see on this slide, it was also part of the 2019 recommendation management audit on the Sheriff's Office enforcement. And as you know, there's a contractor working on a staffing study, and civilianization is already part of that scope. And so they're already working on that. And with that, we'll go to slide 3, please, with Captains Paget and Oberdorfer.
Good afternoon, Supervisors.
My name is Adam Oberdorfer. I'm a captain with the Sheriff's Office and the Division Commander for our Training and Compliance Division. This afternoon, I'll be focusing on the information related to the Enforcement Bureau. The concept of civilization of the Enforcement Division was presented to the Board of Supervisors as part of the Harvey Rose 2019 management audit, as Martha mentioned, and it was also included in the scope of work for the contract to study the staffing within our office. The Enforcement Bureau has just recently begun working with the County Exec's Office on the enforcement portion of the staffing study. We are expecting to meet with the contractor, which is named CGL, in the coming weeks for a formal kickoff. With that said, we have already started to collect and gather the information and documentation requested by the vendor to date for the Enforcement Bureau. We are hoping that a finalized staffing study will be completed in early 2021, and that will shed light on the enforcement staffing in many key areas, including how to best utilize professional staff within our office. And now I'll turn it over to Captain Pageant, who will provide some information regarding our Custody Bureau.
Thank you, Captain Oberdorfer. Good afternoon, Supervisor Zellenberg and Supervisor Wasserman. My name is Captain Pageant. I'm the captain at the Elmwood facility out here in Milpitas. I wanted to say a couple things, echoing what Captain Oberdorfer just said about our staffing study and looking at civilianization of some of our staff. We're looking forward to our previous staffing report that we've worked with CGL as well, to get their opinion and get their reports as far as how to best use staff, current best practices using both badge, sworn, and civilian staff, as well as current relief factors that are consistent in custody environments. So a few other things to go off of. I know there was the Harvey Rose audit was talking about the potential of reducing costs with the reduction of the inmate population within our systems. A lot of things dictate that we keep housing units open right now. COVID has had a huge impact, obviously, in the jail facilities and staying safe and keeping the virus out of our facilities is our goal. With that, we're not able right now to close any housing units. We have every housing unit open, which creates additional labor that may not be seen when you look at overall just a reduction of numbers. Working with public health and custody health, we do what we can do to social distance the best we can, to have quarantine units, to isolate those arrested and keep those newly arrested away from the general public. Those are all contributing factors of why we're unable right now to shut any housing units down. Like other agencies, the Custody Bureau has been impacted by COVID-19 itself as well. A lot of these issues are related to child care for staff and also 14-day quarantine protections and post-exposures. The Custody Bureau, like the Enforcement Bureau, is awaiting any of the staffing study, like I had said previously. So a lot of other things we do within the jails that are additional costs, additional cleaning supplies, additional staff to maintain 24-hour temperature screening of all civilian and sworn staff that come into custody. We also use staff to issue our commissary back to our inmates. Once we started, we initially had stopped all of that, and then slowly we started to release things like that back to our jail population. Currently, staff does distribute all that. Previously, it was, I believe, maybe 10 to 12 civilian staff from the vendor that we have a contract with. Additional cleaning supplies, like I said, additional PPE equipment to staff, increase in food costs due to COVID, and a lot of other food is prepackaged instead of made on site. So a lot of these factors continue to increase, and therefore it's hard to reduce operational jail costs right now. And that being said, I'm available for any questions.
Moving on to Deputy Chief Nick Bircher for the juvenile institutions.
Good afternoon again. We just have a couple of quick slides here that we can comment on. And the first one was reducing the juvenile facilities populations to reduce the reliance on secure confinement. The last 6 months, if you take from the population in the 6 months that we've kind of been involved in COVID, pre-COVID to today, we've had roughly a 50% reduction in the number of youth at both our juvenile facilities, the James Ranch and Juvenile Hall. It's a significant number of youth that are no longer in our custody and care, but kept in the community. I'm proactively working to process early releases for eligible youth. We're probation department in collaboration with our justice system partners. We've been working collaboratively since the inception of the pandemic to detain only those youth who pose the most significant community risk. We've also worked with our local law enforcement agencies, courts, public defenders, district attorneys, to really make sure that the youth who are coming into custody are those that are appropriate, and so that we're not having kids brought in just for us to release them that same day to their parents. And I think that we've shown a significant progress in that area, and certainly the numbers of kids that we have in custody today, I think, show that. COVID-19 has required the opening of additional housing units at both Juvenile Hall and the James Ranch. So in an effort to create an environment where we could really mitigate the spread of COVID-19 in a congregate care setting, we have opened up 3 additional units here in Juvenile Hall and the same at the James Ranch. By doing so, we've been able to reduce the population in each unit to create the appropriate social distancing according to public health, so that it becomes a safe environment. We've opened up 2 intake observation units, and I think it says they're quarantine units, and they're not quarantine units because these kids have not been tested positive. These are just the intake of youth that come into custody, and we have 2 of them so that we can continue to provide the proper social distancing and not let those units get above 8 youth, so that we have the proper social distancing in the event that one of them does have COVID-19. Since the inception of COVID-19, we've only had 3 youth that have tested positive, and all of those youth have been caught being positive at their first intake. So they've not gone to other housing units where it could spread. Through, I think, protocols with the public health department, custody health department, we put in really significant key measures to make sure that the population of kids that come in here, if somebody does has it, it's not going to spread to another unit or to staff. The question on the closure of DJJ, the Division of Juvenile Justice, this is just recently passed. And I know that it was brought up about the number of kids that may or may not come into custody. Today we have 33 kids at DJJ. Just that in itself will almost double our population as we move forward over the next 2 years, as kids now are no longer going to go to DJJ but stay here locally in our juvenile detention facility. And then the increased operational costs to support the youth's ability to communicate with parents and community-based organizations. The department, with the help of the county's IT department, our own IT department, has been able to secure and acquire computers and tablets, allowing the ability to communicate with parents, community-based organizations, to keep that connection alive. The technology allowing the youth the ability to participate in essential services provided by community-based organizations is key. When we first started this, there was a big push to get that technology up and running so that we could have and maintain those community connections with youth, their parents, their CBOs, and their contacts. And I'll take questions if you have them.
And that concludes the presentation, Madam Chair.
Thank you very much. Supervisor Wasserman, do you have questions or comments on the report? Sorry if you're waving at me. Let me put my screen back up. Okay, that looks like a no. But just briefly, the report provides a good snapshot of the status of staffing in custody settings and how our departments have been impacted by the health crisis. But I was disappointed in the response regarding the civilianization of sheriff's positions. Waiting until the completion of the staffing study, to me, is not a reasonable option anymore. The staffing study was requested way before I joined the Board of Supervisors, and I'm afraid that if we hold off decisions saying that we are continuing to wait, I could be replaced as well on the board. I would like for the sheriff and probation to provide their own analysis and recommendations for positions that could be civilianized. This is something that we can do without waiting for the staffing study results. Yes?
we can work on.
Probation
And Supervisor Ellenberg from the Sheriff's Office, and we'll look into it and advise.
Thank you. I appreciate that.
We'll do the same, Supervisor.
Thank you so much.
Madam Chair, I think when I responded to you earlier and was saying no, I didn't realize I was muted. So thank you for asking me if I had any comments. I think your suggestion you just made is a good one. We just want to make sure we're not compromising, obviously, any safety and security going forward. So thank you.
Certainly, and I agree with you. And I don't know if the request for the staffing study predated you as well.
I don't recall.
But I think it's time to move.
I can't imagine it did, but
all right.
Again, I don't know.
Thank you. I think with that, we can move on to item 7, which is to receive a report from the Office of Gender-Based Violence relating to its first annual report. And congratulations in advance on that to Carla. Do we have any public speakers on this item?
I see no requests at this time.
All right, Carla, the screen is yours.
Okay, thank you so much. So let's just get right into it. Thank you, Supervisor Ellenberg and Supervisor Wasserman. I am Carla with the Collins with the Office of Gender-Based Violence Prevention. And today, along with Julie Ramirez, we'll be giving you a brief report on our first year of work. So as has been said, we're part of an amazing division and vision for our county and the 7th office to join the Division of Equity and Social Justice when we were formally approved by the Board of Supervisors on September 24th, 2019. And our goals are no short order with a very, is the slide advancing? I'm sorry, it's hard for me to see.
I don't see a slide.
We don't see your screen, Carla.
Oh, well, that's, okay, let me try to do that. I'm doing share screen and I believe I'm on it and, oh, the share button. How about now?
There you go.
Okay. So
it doesn't, I don't know if it matters to you, but it's not in presentation form. We can see all of your slides on the left.
Okay, how about we do this then? Now does it look?
There you go, perfect.
Okay, all right. So we're gonna do a quick presentation on who we are and what we're doing, but really hoping to give you a highlight of this past year. And let me just go back one. Our goals really have been, they're huge. We have a very serious commitment and support of the board and our county exec, and we intend to transform the way our county responds to gender-based violence. And much like the work in the division, we do so with an intersectional lens, looking at the spectrum of violence and abuse, including sexual assault, human trafficking, and domestic violence. So to do our work, we maintain these guiding values so that before we fund a service or support a policy, or even engage in research and analysis, we ask, is this trauma-informed? Is this survivor-centered? Are we using an equity lens in this diverse county? Are we being culturally responsive? We know that you cannot adequately address what you cannot measure, so we are also data-driven and accountable to our community. To say we've been working hard this year is an understatement. So today what we really want to do is highlight some of the amazing work that we've done. And in the first months as an office, we were really focused on infrastructure. For our first year, we hoped to solidify our reporting, to work to establish data collection that makes sense to all of our partners, and to start the implementation plan so that we can be clear on how we define success and how do we operationalize this plan. So part of the infrastructure includes reporting to PSJC twice a year, and we're proud that this is our first time being able to do this. And then almost 6 months in, a global pandemic took over and we had to immediately pivot our work, really focusing on how to modify the current budgets for services that we had in the community so that the needs would be better met. And in fact, we modified 7 contracts between April and June, provided updated referral lists for our EOC. We engaged in COVID-19 live from the county media presentations and worked closely with our emergency DV shelter providers, the City of San Jose and our county housing partners, and the Emergency Operations Center to create a coordinated referral process so that those who called into our county COVID-19 housing hotline, if they were also living with gender-based violence, Well, we have an official process now to connect them from our line to a confidential advocate. So not only will their emergency housing needs be met, but they'll also be better resourced to fill needs like safety planning, counseling, emergency funds for survivors and the family. And we're still deep in the middle of COVID-19, so addressing the impacts of how one might shelter in place when home is in fact not safe is a priority in all that we do to prepare for the future. So we'll continue working on 3- and 5-year projections, measuring success with space for new and emerging trends, and work toward an alignment of funding in the 3rd year. We do intend to have both a policy agenda and a legislative agenda that is data-driven and grounded in innovation, but that's really part of what's still to come. Let's see. So let's spend a few moments on what we've achieved already. There's a great African proverb that says, if you want to go fast, go alone, and if you want to go far, go together. So we're a small team in a relatively small division. So everything we do and truly every single success we create is because we've done some incredible work that is in partnership with others. One of our goals as an office is to create the space to do really intentional work, to have those sometimes very difficult conversations, and definitely to go far. You don't get to transform systems doing anything less. We do work closely with the Domestic Violence Council and the Human Trafficking Commission and support and even fund efforts with the Sexual Assault Response Team and the South Bay Coalition to End Human Trafficking. We have a big list of county and community stakeholders with whom we meet and work. And in fact, in the 1st year, our office has prepared and presented 15 legislative files at board policy committees and/or Board of Supervisors meetings, and convened 27 stakeholder meetings on a variety of topics, including things like input on just how our office should run, to sheltering during COVID-19, to flexible funding and other process improvements with vendors, as well as possible permanent housing options for survivors. Let's see. And because we've had the privilege to do more than just what I would call the basics, we have had several innovative initiatives and policy development efforts that I sometimes like to call pilots. It's important to note that rape crisis center services are extremely important for survivors of sexual violence, from confidential advocates to be with the patient during forensic medical exams, to court accompaniment, to counseling, so that people can process and ideally heal from trauma. But this is also a state mandated service, and like many state mandates, one that it does not adequately fund. So our county leadership, however, put its own budget to the words of support. And for the first time ever as a county, we have funding for both infrastructure and direct services for victims of violence that our office oversees. We started a strangulation response pilot that takes victims of domestic violence that have also experienced non-fatal strangulation attempts and provides a special forensic medical exam. This pilot started in January of 2020, will run through December, and we anticipate data from 100 patients. This will help inform true costs to this very dangerous occurrence and help us navigate whether and how it can be implemented countywide. We are working on what works to interrupt batterer intervention and are excited to have been selected as one of 5 sites in California to have a controlled study on effective intervention to work to ultimately keeping families safer. So we work very closely with probation, and much of the work to launch this control study was the work of FY20, and the control groups will actually begin in October this month. So we're doing important, incredible work with stakeholders to create a data collection and analysis agenda and to engage survivors in meaningful trauma-informed ways throughout all of our work. We've started work on exploring options, not just for emergency shelter, but permanent DV housing. And we've started a multi-year initiative to look at the work from the early 2000s and to see how today we can better address the county response to the co-occurrence of child abuse and intimate partner violence.
Carla? I'm just going to interrupt you briefly. The report is phenomenal, and we have all of the detail attached in our file. We have a study session as well today. So what I would like is for you to wrap up with, maybe your top 2 or 3 highlights that you are most proud of and excited about. And I don't want to minimize the value of the report, but I also want to respect all of the committee's time as well.
Understood. And we have just a few more slides. What I'll do is move forward. and let Julie speak really briefly about our community grants program, because that's really powerful impact in the community. And then we'll
Okay, and then we'll wrap it up, and
Absolutely.
and with if anyone has follow-up questions on the full report, I'm sure that Carla would welcome receiving those. Thank you again.
Of course. Julie, do you want to speak briefly to the?
Yes.
Okay.
I can do this briefly, and it's really, really important to share with you this community grants program that we rolled out this year that speaks to the principle of budgeting to our values. We want to invest in our community and provide the resources to the agencies that are working directly with those in need. So we organized our priorities in 3 categories: direct service, prevention, and innovation. So you'll find a complete list of contracts in the report, but and you can, I'll leave that to you rather than going through some of those highlights. But I want to point out that the largest investment is with direct service at over $5 million. And for the first time, we really had a strategic and intentional approach on funding and supporting prevention efforts in our community at $1.6 million. And these programs are reaching populations that we hadn't done in a coordinated way before. For example, focusing on engaging men and boys, working with our immigrant community. And then the other area is with innovation. And you heard about those fabulous programs that Carla had just described. So all in all, our community grants program is funded at more than $7.7 million, resulting in 22 contracts, 7 direct service, 11 prevention, and 4 innovation contracts. That's a breakdown of those numbers. There's about 9 vendors who provide all these services. And I'm really proud to say that all the services are provided. There's some services provided in each supervisorial district. And I know that's really meaningful and powerful to you all. So I wanted to throw that out there. We did a communications plan, and all I'll say on that is that you can follow us on your social media channels. And I believe you both do. We're at SCC End Violence. So thank you for following us. Carla?
And just to wrap up, if you think this is a lot of work for 11 months, just wait till you see what we report back for next year and the next annual report.
Fantastic. We'll make sure to give you a bigger time slot next year.
So much.
Thank you so much. Supervisor Wasserman, do you have any questions? And Carla, you can go ahead and stop your screen sharing.
Okay.
Thank you.
And no, ma'am, I do not.
All right. Then with that, I'm looking to see if anybody else has questions that I missed. Damon.
Supervisor, can I just make a quick comment? And I wanted to thank Julie and Carla for their presentation. And I'm really excited to hear about the grant and looking at battery intervention assessment. I've spent so many years, we've been working on a very kind of one-size-fits-all intervention, in particular, for instance, with 52-week course. And I've talked to, for instance, Judge Chapman, who was a champion of this work for so many years, and really taking a page from probation and their evidence-informed approaches on how to best serve and break this cycle of violence. So I applaud you guys for this work and looking at it through a new lens and potentially breaking out of that mold of a kind of one-size-fits-all intervention model. So thank you.
Thank you for that. And thank you also for recognizing Judge Chapman's really tremendous leadership and an initiative in this area, and wishing her well. Any other comments before we move on to our last substantive item, which is our study session? Item 8 is to receive a report from the Behavioral Health Services Department, Office of Reentry, Custody Health, Probation Department, Superior Court, and Office of the Exec relating to the intersection of criminal justice and mental health, which I think above nearly anything else other than COVID has been one of the biggest challenges and primary areas of interest and conversation in our county. So I hope that we've got lots of people listening to the conversation today, and we'll find opportunities to weigh in.
Yes, Supervisor, this is Martha Rapansky again. I'll keep my comments extremely brief. I do want to note that toward the end of this presentation, Or
Yeah,
is
you
mine-
can hear-
We can't hear you.
Yeah, Martha's audio.
Yeah. Martha, can you turn it to somebody else to lead, or can I just tee up the behavioral health services first?
She can locate the mic.
There you
on
are.
the screen.
That's okay.
Sorry. Go ahead.
Okay, thank you so much. So I will just do that. Ask the first department to begin with their presentation. Thank you. So sorry, Martha.
Good afternoon, Supervisor Ellenberg and Supervisor Wasserman. Sherry Terrell with Behavioral Health Services Department. I'm going to actually go ahead and turn it over to Gabby Olivares, our Division Director with our Criminal Justice and Jail Diversion Services, and she'll be walking you through the presentation for behavioral health. Thank you.
Thank you.
Good afternoon. Can you hear me?
Yes.
Okay, wonderful. Again, my name's Gabby Olivares, and I manage all the jail diversion programs within the department. So in the Behavioral Health Services Department, criminal justice systems uses intersectionality to study and understand the ways in which categories such as sex, gender, ethnicity, poverty, race, and criminal justice intersects, and how these intersections impact a person with mental illness. So before you, what you have is, through our assessment and screening process, here are the profiles that we see of our criminal justice, substance use, and mental health disorders clients. So our clients have a history of criminal justice involvement, a history of housing scarcity, a history of food scarcity, history of substance use concerns, history of mental health concerns, history of unemployment, history of psychological trauma, history of lack of social support. These intersects result in compound disadvantages that lead mental health professionals to further investigate the impact on the mentally ill, co-occurring, underserved, justice-involved populations. Can we please move to the next slide, slide 3? So the intersection of mentally ill individuals with justice involvement has really focused our attention on the prevalence of co-occurring disorders, lack of homelessness, and social support. So before you have our continuum of care. Our crisis residential is very utilized. Our intensive outpatient services, our full service partnership, our forensic assertive community treatment team, which is one of our newest services, provides co-occurring treatment. And in the middle, you'll notice we have our faith-based services. I'm really calling out this program. This program is not per se a mental health or a substance use program, but it's really a program that provides support and peer mentorship. This program is in the middle of our continuum because regardless if you have high intensive needs or lower intensive needs, our clients really gravitate to this program. So what it really tells us from a mental health perspective is that our consumers want choice. They want to be able to identify their treatment needs. And if they're not ready for treatment, we get many referrals from our faith-based services. People, when they come out of custody, what they want is their social needs met. They want to know that they have somewhere to live, they have food, and they have support. Rarely do we hear from people that they want to know when their next psychiatric appointment is, who's going to be providing their care. So we really work closely with our faith-based providers to provide that support regardless of where you are in the highest part of our continuum or our lowest level of continuum. Following our Evans Lane residential, which is gearing up to start providing co-occurring services. Our co-occurring program that it's the first in the division. It's been highly utilized. Our aftercare program, which is a really nice program as people are finishing up their court probation, any type of supervision that they have, they're able to step into this program where we just check with them, did you get your service needs met? Is there anything else that you need before you move on? And you're able to access other services within the department. Okay, so moving on to our next slide. Here you have how people come to us. How do people access our services? So most of our referrals start within the jail. Custody Health conducts a mental health exam by a nurse. If the individual is identified as needing behavioral health services, he or she is referred to a psychiatrist or a clinician during the booking process for further mental health evaluation. If it's suspected that a mental health or substance use disorder was a reason for this offense, for their offense that they committed, they can send our judges in Department 60 and 61 a request for a mental health clinician to do a screening. Once the screening is done, that recommendation is sent to the referring judge. The judges that sent the referral and the judges from Department 60 and 1 have some consultation, and it's determined if that case should be brought to Department 60 and 61. So previously, that was our business model. All of our referrals were coming from the jail and the court. If you look over to the right, it says referral from probation. And we've expanded our net. We are not only getting referrals from people that are in custody, but if people are in the community, they have a probation officer, the probation officer really feels that this individual would benefit from mental health, substance abuse services through our Prop 47 initiative. Now we're able to take direct referral from our probation officers. A referral is sent to our Prop 47 inbox. Our staff scan it. We contact the client and we start the assessment and screening process. So whether you're coming from the jail through our court system or through probation, you have access to our in-home support teams, our supportive office of supportive housing, which offers treatment and housing resources, the array of outpatient services that we have, our specialized programs that go out into community like our forensic team, or you also have access to our residential care services. Next slide, please. So since 2018, we've really seen an upward trend of the total numbers of clients that we serve. These programs continue to increase. There are two measures of success for clients that we're diverting out of the jail. So our first goal is to increase the percentages of clients diverted from the jail into the appropriate level of care. The second measure is to look at people that come out of custody. Were we able to engage them in treatment 30 days or longer? So below you, you have the outcomes for these two goals. So in FY 18-19, we served 920 unduplicated clients. FY 19 and 20, we served 1,800 clients. For FY 2021, projecting to serve 1,900 clients. Below you have the days of service, FY 18-19, 11,000 days, FY 19-20, 15,408 days. And we're projecting to continue to trend up 1,600 days. For our second outcome, these are people that have been in treatment 30 days or longer, FY 18-19, 1,587, and FY 19-20, 1,796. So we really anticipate that putting these metrics in place are helping us to retain people in treatment 30 days and longer, which will result in a decrease in our recidivism for this population. Next slide, please. Okay, so what are some of the things that we continue to work on where we know that we have some process improvements? Currently underway, we have recently launched our Universal Screening and Assessment Work Group. The development of universal screening and assessment tools are underway that can be utilized in various justice settings, as well as expanding efforts to our plea diversion cases. These tools seek to integrate mental health and substance abuse for justice-involved individuals with co-occurring disorders and will lay the groundwork to reduce recidivism unmet needs. Behavioral health is focusing on core principles such as integrated treatment, working closer with our supervision justice partners to include them as part of the team. We're looking at new evidence-based practices to coordinate and keep people stable in community. We are also looking at improving our care coordination. In order to improve care coordination, behavioral health and Justin partners are working toward instituting more case conferences. This is traditionally done just with treatment, but we're really looking to integrate our efforts with our justice partners and having them participate to understand what the needs of the consumers are and what additional resources we should be linking our clients to, and how law enforcement can help us to bridge those gaps. Next thing is our discharge planning. Thus far, this has been very successful with Custody Health, especially during COVID. We've developed more collaborative relationships. We've really relied on custody to let us know how the clients are doing now that we're not able to access custody. So the next thing that we want to implement is just looking at data. What data are we collecting through these case conferences? And how is planning and accessing services more effective? And having regular meetings with our Custody Health partners to work on identifying these case conferences in a more timely manner and making improvements. And lastly, what's been very beneficial and we continue to move forward is our innovative remote calendar hearings. It's really allowed us to monitor the progress of our clients, to appear before the judges, to get progress reports and not having to be in the courtroom. And it's really allowed our judges to have FaceTime with our clients and really congratulate them when they're doing well in treatment, and to encourage them and support our partners through all the work that we're doing. Thank you.
So good afternoon. This is Javier Aguirre with Office of Reentry Services. I just have 3 slides. The first slide is a slide to demonstrate how do our clients learn about mental health services. So while they're in custody, there's brochures, visual information for clients to understand the services that they could receive upon release. And then through our community-based organizations in the community, staffing the resource tables and at the reentry center. And then we also have a lived experience advisory board that allows us to enhance and engage clients in the community to improve an understanding of mental health services in the community. And most importantly, when a client arrives at the reentry center, they can access behavioral health services by requesting that, seeking a screening and assessment by the behavioral health team at the center. And so an individual will come to the center, will be walked in, and will be socially distanced in a safe and indoor environment to have that communication with a professional clinician. And then also we have the medical mobile unit at the center that our clients can see a psychiatrist or a physician. And then another portal that clients can learn more about mental health services is the Sobering Center. So that's where law enforcement agencies can bring clients to the Sobering Center to access those services. Next slide. So another piece of the intersection of our clients with mental health in the criminal justice system is, what does the data say about their outcomes? So we've been working with behavioral health to identify the service gaps and also the outcomes. So on this slide, it shows the successful completion rates for the different modalities. Keep in mind that part of the adult reentry strategic plan, our goal is an increase to 60% of clients receiving AB 109 funded mental health and/or substance use treatment successfully complete programming. And what is successful completion? That's completing the program or that they transfer to a lower level of care. So as you can see, the AB 109 PRCS post-release community supervision is at 91%, but that only encompasses about 12 clients. So you'd see a high percentage. The ones that we are very closely looking at is the full service partnership. It's one of the highest modalities for behavioral health, and it does show almost 25% successful rate. So that's where, you know, the community-based organizations provide full services to clients from housing and navigation psychiatric services. So in partnership with behavioral health, we're looking how we could increase that engagement. And one of the ideas that has come up is many times when clients relapse, they may lose the opportunity to go back into that treatment facility, whether it's mental health or substance use. So we're looking at leveraging the Sobering Center as a way for clients to access a Sobering Center so they could get that services and then return back to the treatment provider. Next slide. And this is my last slide from Office of Reentry Services. So how does our work as a staff, how do we hold each other accountable? How do we hold our agency department accountable to ensure that our clients receive services? And one way is the Community Awaiting Placement Supervision Program, CAPS. So weekly case conferencing sessions. Gabby mentioned the case consultation. Well, this is one example where you have a team of staff members coming together, understanding how the clients are being linked to treatment. Are they getting linked to housing? Are they getting the public benefits? Are they getting peer mentor service navigation? What other services? And this is, we work very closely with probation. We have a dedicated probation officers who then can report out in terms of their history and are they reporting back to probation and how we could increase that engagement. So again, CAPS is a model of how do we hold each other accountable to the work that we do. Thank you.
Thank you, Javier. Through the chair, this is Tony Felice stepping in for Ms. Wapinski.
Thanks, Tony.
And just wanted to hand it off to Custody Health Services, and we have Dr. Day, Anu Peru Matam, and Olivia Fojas.
Fantastic.
Okay. Okay, good afternoon, Supervisor Ellenberg and Supervisor Wasserman. Custody Health Services intersects and collaborates with the greater system by providing psychiatric assessments, medication management, crisis intervention, behavioral management, individual and group counseling, and release planning for patients housed in Main Jail and in the Elmwood Complex. We aim to do this by providing the highest level of professionalism and integrity to our patients. Our primary role is to assess the patients, to treat and stabilize the patients, and to assure linkages with resources and to prepare the patient for seamless discharge to community-based programs for continued services and for continuity of care in general. We achieve this in collaboration with our Behavioral Health Services Department and other county and community stakeholders through programs such as CAPS, that was mentioned, AB 1810, and Behavioral Health Treatment Court. Next slide, please. And we do provide 24 hours a day, 7 days a week care. And we manage this through both booking. We have psychiatry services that are 24/7, physician services, and we have clinicians on all watches as well as throughout the day. Custody Health Services, with the 24-hour day, 7 day a week service, we manage both planned and unplanned discharges. And those planned are when we have a scheduled release, and unplanned are when we have a court release bail or SORP. As you know, our collaboration with the Behavioral Health Services Department and other stakeholders is essential for the patient's continuity in care. Outcomes for patients' discharge include release to self, release to family, release to shelter, program, or release to either medical or psychiatric hospitals and other correctional and or forensic facilities. With advance notice, patients are provided with essential discharge medications to pick up at Inburn or other county facilities. Without advance notice, we assure that the patients are given contact information to call back in so that they can get their prescriptions sent to one of the county pharmacies for their essential medications. And as has been mentioned, Custody Health Services is in constant and continuous discussion and communications with other stakeholders in the county regarding emergency psychiatric services and other community resources for continued treatment and stabilization of our patients as they're released from custody. Thank you.
Thank you. And for probation, we will transition to Chief Garnett, Deputy Chief Gapley, and Bernadette Gonzalez.
Great, thank you, Tony. And I will hand it over to Deputy Chief Lay.
Good afternoon, Supervisors. Deputy Chief Gapley with Adult Services. Probation provides supervision and support to clients with serious mental health challenges who are on probation. Our wellness unit are dedicated to work with our clients. The success of our clients does not come from the work of one organization, but definitely require coordinated efforts with multiple system and community partners. I'm going to turn it over to our division manager, Bernadette Gonzalez, to present the rest of the slides.
Thank you, Gab. Good afternoon, Supervisors Ellenberg, Wasserman, and board members. I want to start by saying that probation's core values are rooted in our belief that every individual has the potential to change. We do strive to assist the whole person in developing the skills necessary to maintain their health and refrain from further involvement in the justice system. Ultimately, our goal is to support our clients and work with treatment teams in order to help our clients remain in the community. In terms of how we engage and respond to our clients, we utilize an assessment process focused on the principles of risk, needs, and responsivity. Like behavioral health, our case assessment and case planning takes into consideration our clients' needs and challenges, as well as their strengths and resources. Using these tools, we're able to match clients assessed at a moderate to high risk to reoffend with an officer in our wellness unit for community supervision. In terms of collaboration, we regularly meet with our other partners to discover how our services can complement and build on one another. In terms of the community supervision that we offer, our officers work with clients to co-author a case plan outlining goals aimed at addressing behavioral issues which are associated with criminal risk, and they also refer clients to treatment services. Several of our officers facilitate gender-specific groups using moral recognition therapy, or MRT. This is a treatment program aimed at enhancing moral reasoning and better decision-making, and it has also been shown to lower recidivism. The wellness unit has 2 officers who serve as court officers and communicate directly with clients as well as the court and other justice partners. They provide real-time updates, guidance, and support during these hearings. And lastly, as Javier mentioned, probation officers are assigned to the CAPS team, and these officers are especially essential during that critical time when clients are transitioning to THUs. These officers assist in many ways, especially in placement verification and during intake meetings at the Reentry Resource Center. In terms of outcomes, we can consider the next slide, which highlights clients who exited the wellness unit in 2019. And as you can see, nearly half of these clients had criminal charges, which included violence and were experiencing mental health diagnosis. Most were on medication. I do want to point out one distinction in terms of the number of clients who exited. That number is actually 164, not 244, as you see on the slide. The 244 refers to the number of dockets and not the 164 unique clients. While clients who had a higher level of criminogenic risk were more likely to commit a new offense, and actually just around 1/3 of these clients did suffer a new conviction while on probation, still, of the 164 clients, most were exited successfully, meaning they completed treatment and complied with the terms of their probation. And if we can go to the next slide, I'll say that prior to the SIP, we were preparing a dosage model pilot to refine the quality and quantity of contact with clients. This model shifts the focus from quantity to quality, not only in terms of contacts, but also looks at appropriate time in terms of dosage, which is applied to achieving targeted changes which are needed to affect the risks and needs of our clients. This pilot will also allow for accurate measurement of the client's response to the supervision that they do receive upon completion of a case reassessment. And this pilot may be extended, to the wellness population once the pilot is completed. And lastly, in terms of keeping increased engagement since the initial orders to shelter in place, probation has honored the orders of the Public Health Department while maintaining contact with our clients. Our staff created an amnesty letter, basically in an effort to reach out to our clients who we were not able to make contact with. And I will say that despite the pandemic, many of our officers continue to respond to crisis situations. And when they're doing this, several factors are taken into consideration, including the client's connection to treatment providers, the involvement of a case manager, level of threat to themselves and or others, and their immediate behavior. And this is done all in an effort to resolve the crisis at the lowest possible level prior to involving other system partners like mobile crisis or local law enforcement. And so in conclusion, I'd like to say that our team maintains a focus on evaluating our practices and implementing process improvement, which is aimed at improved outcomes for our clients. Thank you very much.
Thank you, Bernadette. For now, we'll go to Gabby from Behavioral Health.
Hi. So this slide just depicts what our behavioral health team does that we have in Department 60 and 61. So we have mental health professionals that provide screening, assessment, and linkage to Medi-Cal or unsponsored individuals that are part of the criminal justice system. So just some of the basic duties that the team performs is basic triaging of mental health and substance use treatment screenings, presenting our findings to the court, notifying after screening what we have confirmed, the level of care that we believe is recommended, sending the referral and screening to our outside providers, also working with primary health. We have very much a holistic approach where part of our screening, we try to link people to housing resources, primary care. We do co-occurring referral to substance abuse and mental health. And also what we do is, what's a newer aspect of the work that we're doing is more consultation with law enforcement so that we know, is this person that's a high risk to offend, or is this a lower risk offend person? And also part of our work sometimes, not as much now, but in the court is performing a 5150 hold, notifying custody. This person came in, they were unstable. We had to put them on a 51 hold and coordinating that. And I think another big piece to highlight that we do is we collect what's called treatment status reports from all of our providers to inform the court how our clients are doing while in treatment. And we also provide those reports to probation, pretrial, and parole. Thank you.
Thank you, Gabby. And next we have the Mental Health Treatment Court. And I know we have Judge Manley, who just returned from the bench. And then we also have Judge Silva and presiding Judge Ryan.
Thank you. Thank you very much. And I will, can everyone hear me? I hope I just got here.
Yes, sir.
All right, thank you. And
Thank you.
Judge Ryan, do you want me to proceed or would you like to start? All right, thank you.
You go ahead.
Okay, and I thank Judge Silva. I wanted to introduce her to you, but she's kind enough to finish up my calendar so that I could make this presentation. So, and I greatly appreciate her efforts, and of course, Judge Ryan, who leads us and is really responsible for the great success that we are having, in my view. So let me start out by, I presume I can advance my own slides, I hope. No, I can't. There we go. Okay. So to begin with, I want to talk about the development focus and the general direction of the program. This is a unique program in that it was developed by the Superior Court, by my colleagues on the bench and our presiding judges over the years. We had very simple focus, and that was to get better outcomes for mentally ill offenders and to address the growing number of mentally ill offenders in our court and jail. As I hope you're all aware, our state hospitals are completely full. There was no openings for anyone else. The number of individuals who are mentally ill in our jails and prisons continues to increase in terms of the percentage. In our program, we serve between 1,500 and 2,000 people, mentally ill offenders, yearly on an ongoing basis. The program is really pre-plea and post-plea, and in many, many ways, it is a diversion program. So we try to work with offenders at both ends of the spectrum in terms of what goes on in the court, And we focus on really trying to get them out of jail and into treatment. And as Dr. Oliveras pointed out, we have a tremendous team of people to help us with that. We use a non-adversarial approach, and we are working on positive behavior modification. When I say non-adversarial, the deputy district attorney is often the most encouraging to defendants as they struggle through the program as a public defender would be. The public defender may be far more holding the defendant accountable, even though the public defender represents them. So it is non-adversarial. It's a program designed to be positive and move people back into the community successfully. Treatment and housing are absolutely essential to our work. Without them, we cannot succeed. And we're ever grateful to the county for providing those resources that we desperately need. And you've heard in all of the other presentations. Finally, I would say the sauce to a treatment court, what really makes it work is the direct interaction between defendants and the judge. That normally does not take place in courtrooms other than for a very short period of time. These defendants see us again and again and again, and we get to know them well and they get to know us well. But it is that interaction, talking to the defendants, that really makes a difference in my view. Next, I want to talk about the target population, and that is who do we serve, who is in the program. As you will see, it is extremely broad. We take any defendant assessed as being mentally ill, the defendants who are found incompetent to stand trial. All of the misdemeanors are in our program because there is no other option for them other than to leave them in jail for 6 months, which is the maximum period of time they can be held. We also take the diversion cases, all of them, both felony and misdemeanors. This includes individuals who sit in jail for months waiting to go to a state hospital where there is no room. So through the diversion program, we're able to place them in community treatment. It's completely collaborative. And we have the largest number of individuals in community treatment of any court or any county in the state other than Los Angeles. And I think per capita, we have far more than Los Angeles. We also have a very large veterans treatment court and military diversion program where we take those who have served, particularly those now we are seeing who have come back from Iraq and Afghanistan. We take defendants with intellectual disabilities. That's who I was working just before I came into my chambers now. They're on a special calendar. We are the only court I know of in the country that has a special calendar for defendants who are challenged mentally and in the criminal justice system. We also have defendants with traumatic head injuries, which we are seeing more and more of. Not only those coming back from combat, but far more who are already in the community. And I think it's the fact that we're learning more about the relationship between a traumatic head injury and mental illness. Finally, there are defendants who come back from the state hospital or defendants who are very gravely ill. They should not be in a jail. They should be in treatment. And we call this a soft landing, in which we try to move these defendants directly into treatment, stabilize them, and then we get out of the way and they move on with their lives, and we hope are successful. All right, the next slide is the referral process. And so I'm often asked, how do you get these 1,500, 2,000, whatever number it is, into the program? These defendants are all directly referred by my colleagues. So what to me is very interesting about this program and important is that it takes the full cooperation of every judge on our bench. And they are sent here for a pre-assessment, and that means that behavioral health will assess them. We'll talk them into the courtroom, talk them in the courtroom, talk to them, and then send them back to the other judge. That judge then decides whether or not to release them on supervised home recognizance, or to determine what the sentence will be, or to ask us to simply monitor the defendant after sentence. Most importantly is number two. Those who are sentenced, many of them are given a sentence. I would say the vast majority, that is modifiable. And that means that once we find a treatment plan, we can immediately release them into that, and that gets them into treatment, out of jail, and out of the criminal justice system other than for their reviews. We also receive referrals directly from the Veterans Administration staff who go into the jail and interview those who have served in the military. Probation officers refer directly to us, and we have a special calendar for defendants who are on parole, PRCS, or mandatory supervision, and we get referrals from the Veterans Administration, from probation and parole agents as well. The next slide is the offense categories. I just want to point out, you've seen other depictions of this in the presentations today, I'm sure, but the vast majority of the offenders are either charged with or convicted of crimes involving violence, property, and drugs. We also are unique, and we are one of the very few programs that works directly with sex offenders. And thanks to the cooperation of the sheriff in non-COVID times, we are able to register them in the courtroom in a very user-friendly fashion, as opposed to what they perceive and often is a very difficult process for them out in the community. So they come to court, they get the registration done, and that's taken care of. And I raise it simply because this is a large number of individuals who repeatedly are rearrested for not registering. And registration is very important. And so we make a point of having special programs for these defendants in cooperation with probation. Next, I'm going to talk about what makes this work. It does take a team, 2 judges, and I'm very grateful to Judge Ryan and Judge Zecker, my mentors, who we now have 2 judges. We used to only have just myself, and we now have 2. It shows the commitment of our court to what we are doing. We depend to the greatest extent on behavioral health and probation, custody, mental health. Everyone has made presentations today. And I always want to mention the fact that our district attorney's office and public defender's office provide us with outstanding attorneys who understand this really different way of doing business. And it was referenced, I'm sure, earlier that there are specialized probation officers in the wellness unit. I just want to point out one thing about them that I think is really unique. Not only are they trained and do they understand how to work with the mentally ill, but they actually do programs with them out in the community, such as having lunch with them and just talking about things. We call it the family of friends. Cannot do it in COVID times, but before that and hopefully after, we'll be able to do that again. We also have the Veterans Administration staff that goes into the jail, as I said. And finally, we have community case managers and community providers that we see every day. So the next slide is basically, I just wanted to show you, we are one of the very, very few courts in the country who not only is committed to working with the mentally ill, but when we designed our new Family Justice Center courthouse, we provided space for behavioral health, and we have 2 psychiatrists. We have all of our justice partners, the public defender, the district attorney can have an office. The reentry center, we have space for everyone so that we're able, the idea here is a very simple one. If somebody is struggling, if they're decompensating, don't wait, hand them a piece of paper and send them away. Treat them right now in the courthouse, and it works. And because this office space is directly across from the 2 courtrooms that Judge Silva and I use. The next slide, I hope we'll get to here. This gives you the outcomes of the defendants who participate in the program, roughly close to 70%. This does not change. We've been keeping track of this for many years. It's roughly 68 to 70% every year. Some are sent to prison because that was the agreement when they entered the program. Some are sent to jail. Some go to the state hospital. Some are conserved. But the important takeaway to me is that we're able to get 68% who succeed. Finally, I want to talk very briefly on our response to COVID-19. And first, again, I want to thank our presiding judge, Judge Ryan. We are one of the very few courts that designated mentally ill offenders as essential to having the court provide treatment and services to and to hold calendars for even those in custody and those out of custody. And during this time, the average number of new cases that come into our court has not changed at all. It is actually starting to increase as individuals are arrested, in jail, sent to us, go through the process, and then we release them into the community. And now with zero bail, we often do this before their cases have ever really been through the judicial process. Also, as Dr. Oliveras mentioned, one of the great benefits I've seen to COVID-19, if you could call it a benefit, it is not a benefit, it's a benefit to us in that we have learned some new ways of working with people. And that is the remote calendars, the Zoom calendars that we use. They are not reported, they are not official, but what it allows us to do is to go directly into the programs, directly into the room in the boarding house or boarding care home where the defendant is, or in wherever they may be, on a phone or on a laptop. We're able to talk directly with them, and we talk to the case managers. And the wonderful thing about this, is I told you the important things is face-to-face contact. It really works with these Zoom hearings, because we do them 3 to 5 times a week, and we're able to connect with the clients. Next, we have been able to through the assistance and of the Sheriff's Department, and of course our partners in behavioral health, we now have a direct phone line so that the defendants can have face-to-face, not face-to-face yet, but they can have phone contact with the person who's assessing them from behavioral health. It's very important to us that they do get the input from the defendants and talk with them, and we were able to put this into place. Next, we have developed a new psychiatric fellowship program that is going to be funded entirely by the state. No funding will come from the county nor from the court that has none. That program is, I think, is probably one of the most exciting innovations that will come out of COVID-19 for the future, because it will provide fellows who are licensed, certified, trained psychiatrists to be in the courthouse and assist the ones who are already here, and also help us with the evaluations that are necessary in our 1368 and other proceedings, so we can move people through the criminal justice system in a reasonable way, as opposed to constant delays. Finally, I have to always remind us and remind myself that our greatest challenge really is the ongoing lack of sufficient treatment in the community. We can only do what we do in the courts if we have not only the support of all our partners, but if we have sufficient housing and treatment in the community. And we are grateful always to the Board of Supervisors and to our partners, and particularly to behavioral health, for the incredible job they do in standing up programs for those who are drug abusers, those who are mentally ill and drug abusers, which 80% or 90%, I would say, of our clients are. They stand the programs up. The case managers work directly with the defendants. They're on our Zoom hearings. And to me, it shows what you can do in the worst and most difficult and tragic of times. Thank you. I'll be happy to answer any questions.
Wow, Judge Manley, thank you so much for making time for that phenomenal presentation, for the clear passion for your work, and for making it clear to us how much is really in our power to do right now. I want to thank you and thank Judge Silva for making it possible for you to be here, and of course, Judge Ryan as well. I want to confirm, I'm ready to open it up for all of your comments and questions, but want to make sure first that that was the last presentation. Is that accurate?
That's correct. Thank you, Supervisor.
Okay. Thank you. So we just heard a lot of tremendous information and insight, and I would like to hear from all of you. So either actually wave your hand or put up your blue hand. And Supervisor Wasserman, maybe you can help me because you seem to spot people faster always than I do.
Sure. I was putting up a blue hand.
Oh, so, all right. So let's hear from you. And then if you could help me by calling on people that you see with their blue hands up, that would be terrific.
Thank you. And I would guess you and I are the most ignorant, in the best use of the word, on all that's going on as compared to all the other people that we have on our screen today. I've got 25 some people on there. I just wish Judge Manley could get a little more excited about the program, a little more outgoing, a little more vociferous. I just want to say I learned a great deal about these ongoings today, thanks to all of you and the PowerPoint presentation that was in our folder. And it's that courts and county collaboration that is clearly so critical to provide the collaborative, not just the collaboration, the comprehensive services for the clients. And Madam Chair, I'll just leave it at that. I'm very, very impressed with what's going on and how well it's going. And I love whenever I hear we're first in the nation at doing something well. And I thank all the individuals who are involved in this particular program.
Thank you. I'm going to hold my comments to the end because I'd really like to hear from anyone on our panel today that wants to speak.
I think it's, oh, there
Sylvia.
we go, Sylvia.
So as you can see, our county is doing a great deal. And I think our challenge is, as a system, is how can we improve on what we're already doing well? And, you know, we all, I think most of us that work in the justice system or have worked in the justice system as long as we have, which has been 25 years for me, can tell you that every year we ask, how can we replicate Judge Manley, and how can we multiply all that he does? Because his court is a perfect example of what we have to and we should be able to do for almost all of our clients, because it's a model for how things work and how they should work. Meaning that when a client is so mentally ill that requires assistance in housing and basic care and cannot survive on their own, it is the kind of client that shouldn't be in our justice system at all. But the problem and the flaw that we have is that, unfortunately, most of our clients have to be in our system, and we have to get them into Judge Manley's court to get the quality service and the quality treatment that they deserve and that they need. And I think that would be the one thing that I will mention, not to take away at all from the incredible outcomes and accomplishment of Judge Manley's court and what our current setup is. But I think that's where our challenge is that we have a very good functioning system, but it works for the very few. And to that end, I want to actually clarify one piece of information, because I think it might be helpful for both you and Board Member Wasserman. And that is, you heard two pieces of data. You heard Gabby mention, we're diverting, 1,900 people projected from jail successfully. I don't know what that means. I don't know if it means that we are diverting, that is the same number that we're also including in the numbers that are discussed with Judge Manley, meaning that it's those clients that we are serving in the mental health treatment team, or so I think we should clarify that, because I think that we need to begin there. In other words, figure out how many people are we truly serving. It's 2,000 out of what? 2,000 out of 60% of the clients in custody or inmates in custody that have been diagnosed with mental illness, because the numbers are great, but I don't know what the baseline is, and I don't know what the big picture looks like. Because if you look at it this way, absolutely, there's no question we're doing a fantastic job. But if we actually are challenging ourselves to do better and to serve our clients in a better way and expand our way of service, then we do have to figure out how we're going to replicate the system that we've created or that Judge Manley has led for so many years. And we have to figure out how are we going to maximize approaching the service in the same way with even 4 or 5 more courtrooms. Not in the exact same way, because it is so time consuming and there is a lot of dedication that's involved. And I know I don't want to scare off Judge Ryan here, but it's the theory of it, meaning that we need to have judges with specialized knowledge about how to manage clients who have mental illness. We need to have attorneys, the defense and the prosecution that are that well equipped. But most importantly, how are we actually doing in preventing clients from actually coming into the justice system to just get the basic service? Because I think when we get them, sometimes that's a bit too late. And so I think that would be the comments that I'd like to sort of provide and send to the groups for further discussion.
Thank you. Sylvia, does anyone have a response or answer or further comment?
Yeah, so just in response, so yes, there are the
Thanks,
consumers that we have that we're supporting in Department 60 and 61. And I wholeheartedly agree that there should be interventions and strategies, and we should, look at other work before people get to jail. But what other access points, what other things can we do before people end up in the justice system? And I think a lot of our work has focused, here's all the people in jail, here's all the people in court. Okay, let's hurry up and get them out of treatment. But I think we need to take a step back. That's been great, but what do we do so that people don't enter our justice system? What do we do so people don't become dependent on these systems? And as you saw our profiles, these are people that are impoverished, have mental health, substance abuse disorders. So the next step of our work, I think, is working closer with all of our partners to prevent people coming in to the jails, to the prisons. We're losing our CDCR contract, our state parole contract. That was a great contract. We're serving a lot of people. Bruce Coakley and I have just had discussions. How are we going to continue to serve these people now that these services are going out? And his response is, we will continue to serve them. They're Medi-Cal beneficiaries. So I think if we can change our mindset of these are justice involved people, that these are people that are marginalized, it should have access to all of our services, regardless of where they came to us.
So Gabby, I think to me, as still not an expert in any of this, I think you just absolutely hit it. And the behavioral health client profile actually highlights points at which earlier prevention and intervention could potentially keep clients from ever entering the custody system. And just as you mentioned, it highlights how interlinked social services are with public safety. People with a history of food or housing insecurity are co-occurring in individuals who are supported by behavioral health in the criminal justice system. So if we can layer that profile over a CPS database, I suspect we would likely see that many of these individuals actually came into our system as children.
Absolutely.
So the going way upstream and investing earlier, preventatively and very early intervention, I think, not only is a economically sound decision in terms of return on what we're doing, but is a tremendous, all indicators say that would be a tremendous game changer for people's life outcomes down the road. Damon.
Thank you, Supervisor. And I agree with what your observations and what Gabby just said, and the idea of moving as far upstream as possible. I agree with Sylvia that Judge Manley is fantastic and his court's fantastic, and we love supporting it. But I'd like us to envision a world where we put Judge Manley out of business, that we don't have these people in our system at all in this fashion, and that we figure out how, as Gabby mentioned, intervening at many different interfaces along the way, whether it's, as you mentioned, Supervisor, all the way back in childhood, or whether it's us figuring out intervention teams that go out into the community, because frankly, we know quite often where these people are, or at least the most mentally ill are. They're in our homeless encampments. It's difficult to get them out of those encampments for any number of reasons. And I think the mental health experts understand that much better than I, but certainly we're learning it through our outreach efforts. But it really requires dedication to return to those people over and over and over and over again to coax them into the services they need. We may not actually completely solve the problem, but it doesn't take much to walk outside our doors and really see where they are manifesting and where we can interact with them long before, unfortunately, we send our ill-equipped law enforcement agencies to deal with them, who have very few options and really aren't the experts in this way. So what I think of is this strike team of mental health experts that are going out and working in different ways, whether it's law enforcement calling them when there's a crisis, or whether it's actively working these encampments to work with them. So those are my immediate thoughts.
Well, I think Sherry has heard that exact speech from me a number of times. I hope that, I don't know if Dr. Smith is on this call, but that message should get to him as well. I think you're right. This is what we heard. I know you participated in the community conversations over the summer. That's what we heard from people in the community too, whether it's increasing their own safety or the safety of people with mental illnesses. There you are, Dr. Smith.
Yes, I'm here.
Almost incognito.
No.
Glad you're hearing that. I have a couple of other questions, but I'm not going to ask them until I know that everybody has had an opportunity to share whatever they like. Javier?
I think just 2 points. One, and I always reminisce on what probation has always informed us in terms of the criminogenic needs of clients and who needs all the full services and which clients do not need all the services. Because at this, we may do a disservice if we provide a client with too many services. So, because our capacity is not as large as one would hope. But then secondly, we spend millions of dollars in funding treatment services, funding employment, education, service navigation. And if history of social support, history of housing scarcity, and history of food scarcity, if we could identify, currently we have 2,000 people on caseloads, and of those 2,000, is the provider, whether it's a CBO or a county staff, identified how are they being linked to public benefits? Are they linking them to public benefits? Have they done the housing screening for those 2,000 plus individuals? Have they identified the food issue? So I think that's why I think this case conferencing, case consultation, and I go back to the old system, we don't have a county case management system. There's various agencies have their own, but we do have spreadsheets that can tell who is getting what services. And we just have to, as a county, make sure that our providers meet those outcomes and provide those much needed services upfront and before their clients are discharged from their services.
Can I just add something else, just as a follow-up?
Yes, please.
I think we should also recognize, and I, in addition to what I said earlier, I think we need to recognize that as much as we are serving and there are services that we're getting for clients through our mental health court, the sheer fact that they are in our system, we need to recognize that oftentimes the system becomes, the process itself becomes punitive because they have to wait some time to get services. And so I think we also, as much as we want to front load before they enter, we have to also look at how fast are we delivering the assistance at the front door when they are in our front door. So, and maybe others can chime in terms of, you know, the strike team that Damon mentioned is a fantastic idea for the community, but does that happen for us here? You know, when we have departments doing assessments, we have the jail custody staff doing a mental health assessment, and they're managing it, but they're doing it from the clinical side. But by the time the forensic folks, us, the criminal justice folks become involved, it could be months before we even know that we need to go get out there and get medical, the custody health records.
Right.
Because as attorneys, we're not always prepared to diagnose or identify a problem. So some of this, I feel like I don't want us to walk away from this conversation abdicating our responsibility to try to improve in advancing how the earliest opportunity for us to intervene. And I think that's at least one thing that we can improve on, and we should improve on, because delay in the system is built in, it's baked in the cake, but it has a greater, more harmful effect on our most vulnerable clientele, which are the mentally ill, and in particular, if they have traumatic brain injury, they cannot even manage or control, and there's no cure for, but yet they are in our custody for a year or more. So I think that is something that I think we can improve on, and we should aim to improve on, because that could make a difference, not only for our clients, but also for custody time and bed time.
Thank you so much, Sylvia. I really appreciate and value that input. I know that we are running beyond our scheduled time. I'm finding the conversation fascinating. I hope that you are, but I want to try to be somewhat respectful of your time. And glad to hear anyone who hasn't spoken yet wants to share a comment, question.
I think you're good.
Okay, I know that we have one public speaker. Let me just make my last two comments. And again, given the time, I'm just going to kind of toss them out there because I have so many of you from so many different departments at once for, you know, food for further thought, not necessarily for an answer right now, and not even for a formal off-agenda report, just for all of your departments to think about. The reentry annual report, we saw that keeping clients engaged for more than 30 days leads to significant reductions in recidivism. And from that report on pages 12 and 13 and slide 8 of the PowerPoint, we see that behavioral health department program, I'm so sorry about my dogs, completion rate aren't very high, and the outcomes between different program providers offering the same types of services is pretty dramatically variable. I think that this should be further explored. How do we make the provision of services more uniform across providers so that all clients will have a similar chance of success? Which providers may be underperforming, and how are we measuring the success of our contracted programs? So that's one piece that I would like to put out for thought for all of you, particularly in this really scary financial time. I think we all need to be responsible for making sure that every one of our limited dollars is spent in a way that gets us the outcomes that we want. And if we're not getting the outcomes, we have to have the courage to pivot to programs that are serving the needs of our clients. And finally, on slide 12, Custody Health shared that in its discussions with EPS to provide continued stabilization and care for clients discharged from custody, I'm curious, and maybe I do want an off-agenda response on this. I'm curious to hear what that really means. Would CHS serve clients themselves at EPS? Can individuals, unless this is a quick answer, can individuals not be discharged to EPS directly? If that is a quick answer, I'm happy to have it.
Hi.
Hi, Dr. Day.
Supervisor Ellenberg, and I'll defer to Anu. Are you on? Or Olivia?
Yes, I'm on. Hi, the quick answer to that question, these patients will be routed to EPS based on the criteria. If they are on a 5150 or an LPS hold, those patients will be routed to EPS. And there are other patients will be routed to programs or other community agencies based on the discharge planning.
Okay, I think I might follow up outside of this meeting to just understand that a little bit better. Thank you, though. I really appreciate that. We have one public speaker on this item who I neglected to call earlier. My apologies for that. Colin, can you call up the first speaker?
First speaker is Scott Largent. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. The timer will start when you begin speaking.
Thank you. Thank you, everybody. I appreciate that, Susan. I did put my hand up kind of halfway through the conversation, but I do appreciate you taking my public comment right here. The behavioral health system, and maybe I'm just confused about this. I look outside. I look downtown. I look down the street from jail, and I see the same people that I care about, that I advocate for, and all I watch is them deteriorate until the point that they die. And then we're talking a lot about when people are released or when they get back in the system. There's no beds, there's no treatment facilities, there's nothing there. I know you guys got to try to sugarcoat stuff, and you can't always make it look as bad as it really is, but I used to really praise your leadership, Judge Manley. I really did. And it just comes across like you're a snake oil salesman today. It's like that movie, Used Cars, with Kurt Russell. And it's like you're out, selling the 74 Pinto, with the dilapidated tires and the rusty paint. And you're making it seem like it's a brand new Ferrari with a new paint job. I see the results, and I'm not impressed. I wish you people would do an audit with behavior, where they've been, where the outreach teams have been, or just go on a field trip. Your mental health courtroom, Judge Manley, should not be in that nice shiny new building across from St. James Park. It needs to be over here near the Hall of Justice over here. Temptation Island across the street is not acceptable. There is no safe place to stay away from methamphetamines and just this chaos anymore. I think we need a place to go. I think we need a safe place, and it's not here. So yeah, that was just kind of weird. That really threw me off. I mean, it sounded like a good presentation, but I think it's outdated. And I really do think we need to start looking into a homeless court option.
Thank you. And Jess, I managed to call you Colin, so that's 2 times I've done that during one meeting.
It's fine, I just interrupted you.
I think that's all we have on this item, which takes us to item 9, announcements from any of the members who sit on the proverbial dais. Chief Garnett.
Yeah, it was mentioned before, but I just wanted to bring to your attention that the governor did sign a myriad of bills yesterday, including the realignment of DJJ back to the counties that'll take effect July 1 of 2021. So in addition to multiple other ones, one other one just to call out is police won't be able to interview any youth under the age of 18 without notifying counsel first. So it had passed a couple of years ago where it was 15 and under, and now it goes up to age 18. So that's another significant change. That's it.
Thank you, Chief. And I know that your advocacy at the state level has been very influential and helpful in tilting things in favor of kids and in favor of county flexibility and our ability to make decisions locally for kids. So thank you for that.
Thank you, sir.
Other announcements?
Damon.
Sorry?
Damon's got
Damon, thank you. Thanks, Mike.
Thank you, Supervisor. And Chief, thank you for mentioning that. Public Defender's Office will be prepared to staff those additional calls at a 24/7 service. I just wanted to take 30 seconds to acknowledge that yesterday was the 1-year anniversary of us launching our PAR team and the PAR project in this county, which is a real innovative program. It's our pre-arraignment and review team, or representation and review team. I want to thank Matt Fisk. I want to thank Reentry and the Sheriff's Office and the District Attorney's Office. It's been again a real innovative program and allowing us to have early contact with the clients and ideally interrupt that criminogenic factor of the disruption that accompanies prolonged detention. So I want to again acknowledge the Board of Supervisors for the support, as well as the CEO's office.
Thank you, David, and that work really has been tremendously impactful. Thank you. Other announcements? I'll quickly share an update on the work that my office has been doing since the presentation that we had in July on the community conversations. You may already know that my colleagues approved my referral to expand the scope of the Community Corrections and Law Enforcement Monitoring Committee, allowing them to review policies and make recommendations on public safety that go beyond corrections and law enforcement, to a lot of the comments that many of you made today. And on Tuesday, I intend to present a subsequent referral to my colleagues, which will forward those 22 community prescribed public safety reforms to that committee for their review. So I'm hoping to have more news and updates in a couple of months, and would, as always, welcome your involvement and participation. And I think with that, I will adjourn this meeting without hearing any objections to November 5th at 2 p.m. Thank you so much, everyone. Thank you for the additional time. Be safe and have a good day.
Thanks, everyone. Bye.
Thank you, Martha, very much.